We need mass surveillance to fight COVID-19, but it doesn't have to be creepy. The rigorous use of contact tracing, across digital and physical realms, has been credited with helping limit the spread of COVID-19 in a number of places, notably Singapore, Taiwan, and South Korea, as well as Kerala, India. In its current instantiations, such as the mobile phone app that South Koreans exposed to the virus must download so they can be monitored during self-quarantine, it has raised new concerns about surveillance and privacy and about the trade-offs between health, community well-being, and individual rights. Perhaps we are negotiating new social contracts with our neighbors, our communities, and our governments that extend to the role technology plays in responding to a health crisis. And as we negotiate these new contracts, questions inevitably arise about our relationships to the data that exists about us, the sheer abundance of information that we generate, and how it could be used to help us or hurt us. So I guess the question is, can we imagine contact tracing and other forms of data revelation that don't feel like a Judas hole? Part of the answer lies in how we think about the basis of contact tracing, data, and its collection. Work is already underway in multiple countries on how to better regulate data collection, prevent algorithmic bias, and limit the use of mass surveillance, including facial recognition technology. It will clearly be relevant in answering such questions. Perhaps we can start by differentiating between three distinct purposes for contact tracing: one centered on public health, another on patients, and the last on citizens. This is the sense in which countries like South Korea and Singapore have been doing contact tracing for the coronavirus, as well as the attendant medical interventions, notification, disclosure, registration, isolation, treatment. It is about helping make the best use of finite resources in the name of broader public health. Here, contact tracing is how you might contain an outbreak before it gets too big.